Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Here is what I bring to you from the world of medicine. A complete approach. New recommendations for cardiovascular disease risk management before, during and after non-cardiac surgery. The 2024 guideline for cardiovascular management of adults undergoing non-cardiac surgery reflects a decade of updates and new evidence since the guidelines last release in 2014. It is published in the American Heart Association's flagship peer-reviewed journal Circulation and simultaneously in JACC, the flagship journal of the American College of Cardiology. The recommendations address patient evaluations and assessments, use of cardiovascular testing and screening, and evidence-based management of cardiovascular conditions and risk before, during and after surgery in those patients. There is a wealth of new evidence about how to best evaluate and manage perioperative cardiovascular risk in patients undergoing non-cardiac surgery, said chair of the guideline writing group, Annemarie Thompson, MD, M.B.A, FAHA, a professor of anesthesiology, medicine and population health sciences at Duke University Medical Center in Durham, North Carolina. From prior studies, conditions such as high blood pressure, type 2 diabetes, age older than 55 in men and 65 in women, smoking and obesity are known as risk factors that predispose patients to cardiovascular disease. Others have a family history of premature coronary artery disease, which can also put them at increased risk, Thompson said. This guideline is written with the understanding that these and other cardiovascular risk factors and conditions can contribute to negative surgical outcomes if they are unrecognized or not optimized before surgery. Perioperative management of cardiovascular conditions, as in 2014, the 2024 guideline includes a perioperative algorithm to guide healthcare professionals in care decisions for patients with cardiovascular conditions having non-cardiac surgery. The new guideline reviews blood pressure management before, during and after surgery and highlights specific recommendations for patients with coronary artery disease, hypertrophic cardiomyopathy, valvular heart disease, pulmonary hypertension, obstructive sleep apnea and previous stroke. Updated screening recommendations include the new guideline recommends that healthcare professionals be judicious and targeted about ordering screening such as stress testing to determine cardiac risk prior to surgery. The guideline also includes recommendations on using emergency-focused cardiac ultrasound for patients undergoing non-cardiac surgery with unexplained hemodynamic instability if clinicians with expertise in cardiac ultrasound are readily available. The considerations for medication management include newer medication for type 2 diabetes, heart failure and obesity management have important perioperative implications. According to the 2024 guideline, SGLT2 inhibitors should be discontinued 3 to 4 days before surgery to minimize the risk of perioperative ketoacidosis, which is unbalanced pH levels in the blood that can negatively impact surgical outcomes. Emerging data suggest that glucagon-like polypeptide 1 agonists, medication that are used for managing type 2 diabetes and or obesity, may cause delayed stomach emptying. In addition, nausea is a common side effect of GLP-1 agonists and patients taking these medications may be at increased risk of pulmonary aspiration or inhaling stomach content into their lungs while under anesthesia. For patients who are taking blood thinners, the new guideline recommends that in most cases it is safe to stop blood thinners several days before surgery, proceed to surgery and then start taking blood thinners again after surgery, most commonly after hospital discharge. Additional research need identifies as myocardial injury after non-cardiac surgery or injury to the heart that occurs either during or shortly after non-cardiac surgery is diagnosed by elevated cardiac troponin levels after surgery. In patients who develop MINS, outpatient follow-up is recommended to counsel patients on how to reduce their heart disease risk factors. Patients with newly diagnosed afibrillation have an increased risk of stroke, and guideline authors recommend closely following these patients after surgery to treat reversible causes of afibrillation and to consider the need for rhythm control and or the use of blood thinners to prevent stroke. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.